Hello and welcome to Pregnancy Info. Today we will discuss all about the 7th month of pregnancy. Here we will discuss all the symptoms, problems, and how to deal with this month of pregnancy. Now you are in 7th month pregnant, your little one is growing quickly and starting to look more and more like the baby you will soon meet. For example, she is plumping up and her skin is becoming less transparent. Your baby is also growing and you may face some physical changes as a result. Try to keep in mind that every day that brings you back pain or tiredness also brings you one day closer to meeting. So let's start with the symptoms. Common pregnancy symptoms at 7th. You are entering the 3rd trimester, the home stretch. Around this time, it's common to feel the effects of your growing tummy and progressing pregnancy. Symptoms at 7th month pregnant can include sciatica. As your uterus grows, it can put pressure on the sciatic nerve, which can then cause hip or lower back pain. In the pain start in your lower back or hip and travel down one leg, it could be sciatica, but only your healthcare provider can make a diagnosis. If at any time you notice numbness in your leg or feet, let your provider know right away. Sciatica is likely to go away after your baby is born. Pelvic pain. Do strange and unexpected things to your body. For example, they help loosen the joints that connect the two sides of your pelvis in preparation for labor and delivery. This can cause pelvic pain. If this strikes, try to stay off your feet as much as you possible. Your healthcare provider can also give you stretches to do that. It may help to ease your discomfort. Constipation. High levels of the hormone progesterone and iron, if it is your prenatal vitamins, can slow digestion, making you feel blocked up. They help alleviate constipation. Keep yourself hydrated. Water and prune juices are great, and make sure you are getting enough fiber in your diet. Good sources of fiber include beans, whole grains, fruits, and veggies. Braxton Hicks contractions, sometimes called practice contractions. Braxton Hicks contractions can bring in the 2nd or 3rd trimester. They sometimes feel like a slight tightening in your abdomen, and they usually go away when you move or change positions. They are more likely to occur later in the day and after physical activity like exercising or sex. Fatigue. Some moms to be experience a boost of energy during the 2nd trimester, but as you begin the 3rd trimester, you may start to feel a little more tired. One reason for this is that by 7 months pregnant, your belly has grown quite a bit and it may be more difficult to get restful night's sleep. Try to rest when you can, even if that means taking some time out during the day. And sleep on your side using a pillow to spot your growing bump. Bleeding or spotting. Some light bleeding or spotting can happen around this time, although it may not be anything serious. Check with your healthcare provider. Just in case, bleeding can sometimes be a sign of a problem, so consulting your provider can give you peace of mind. Difficulty in walking as your limbs and bladders are subjected to pressure incurred by the growing belly. Back pain due to weight gain is common in this month. Frequent mood swings, don't worry, as they are quite normal and happen with all pregnant women. Abdominal discomfort and frequent contractions will become a part of your routine, but you will feel some settled in the 7th month. Your body during the 7th month of pregnancy. As your body starts preparing for delivery, it undergoes several changes during the 7th month of pregnancy. We have listed some of the changes to help you manage your pregnancy better. Due to the growing size of your belly, it will be difficult for you to bend. You will experience swelling and feel bloated due to increased blood circulation in the body. You will start feeling extremely hot in all conditions, either it's winter or it's summer. As your baby grows inside you, he will press your bladder even more and you will experience the urge to urinate more frequently. Your nipples will become dark in color and your breasts will become heavy and dense. Your weight will increase tremendously during the 7th month. This could lead to complications like high blood pressure, gestational diabetes, premature birth, or heavy birth weight of your baby. To avoid these medical complications, you need to eat nutritious food and be as active as possible. You may also speak to your doctor or dietitian for proper advice on your diet. Some ladies develop varicose veins due to weight gain, so it's common in this month. Your hemoglobin level could continue dropping since the second trimester. Keep them under check and consume iron-rich foods. Also ensure the intake of vitamin C for better absorption. Start producing milk by this time, and they might also leak yellowish milk rich in vitamins and nutrients. You might also feel breast tenderness. To avoid that, try wearing a well-fitting and comfortable bra. You can also wear it while sleeping, as it helps to spot the heaviness and tenderness. Be ready to experience more sleepless nights and try to manage stress by practicing breathing exercises and relaxation therapies. Bleeding gums is common in the 7th month of pregnancy. It is due to high rate of blood circulation. Excess saliva secretion and mucus formation is also common. Fatigue and headache, lightheadedness, and dizziness. Increased vaginal discharge. It is different in different women. For example, women experience a less amount of vaginal discharge and other is feeling too much. There are many reasons behind it, so consult your doctor if you feel it in very much increased amount. Constipation and gastric problems also common. You might even experience frequent forgetfulness, but don't worry, it is temporary. You might also experience heartburn and hemorrhoids. Hemorrhoid is the complicated form of constipation, so try to avoid constipation by eating fibrous food and drinking a lot of water. Development of the baby in the 7th month of pregnancy. One aspect of the 7th month of pregnancy that will delight you immensely is that your little one is growing day by day and getting stronger too. Here's some information about the development your baby goes through. Your baby is now approximately 46 cm in height, and his height and weight will be continuously monitored by your doctor during the appointment. Its weight will be 900 grams to 1000 grams, or you can see it's about 1 kilogram in a weight. The baby's brain development is at its peak at this point in the time. Hence, you will notice that he is more sensitive to sound, music, and smell. Your baby will move often in your tummy. The baby's hearing has developed more. This is the best time to connect with him. Through sounds, you can talk or sing to him. The baby's body is almost fully developed by now. The fat accumulation will start from the beginning of the 8th month. The respiratory system is fully functional in the baby by now, so there is no cause of alarm in case he pop out after 7 months. Sleeping and walking patterns are more pronounced at this time. Eyes. Eyes slowly open and eyes respond to light and darkness. Skin. Red and wrinkled fat accumulation begins and the lanugo starts to disappear. Tongue. More taste buds develop where baby can distinguish between different flavors. Gastrointestinal tract starts to formation. Bones are beginning to harden. So there is a way the bones are hardening. Skull remains softer. Either all other bones are hardening, but the skull bone remains softened. It is due to the purpose of normal delivery. The baby's position will change in the tummy according to his physical and mental development, and he will sleep more during this phase. In the 7th month of pregnancy, some do's and don'ts you should follow. As you approach your last trimester, you need to be extra cautious and vigilant about your diet and lifestyle. Here's a list of precautions that you need to follow during this period. Do's. Go for frequent walks. Taking a break in between chores and going for short walks is good for your health. Avoid sitting in the same position for long hours. Keep your body active and flexible as much as possible. Engage in a hobby. This will help you feel happy, relaxed, and take your mind off unnecessary worries and thoughts. It can be anything like reading a book, watering plants, painting, or singing. It will help you stay calm and focused. Practice meditation and breathing exercises. It will help your mind stay calm and relaxed. Invest 10 to 15 minutes every day practicing different techniques of breathing. For example, controlled deep breathing, shallow breathing, or breathing from the stomach and breathing from the chest. Regular exercising throughout your pregnancy will keep you active and fit. It will help you recover faster post-delivery. Practice basic stretches as recommended by your trainer and doctor. Monitor your hemoglobin level closely through regular blood tests. Women who have the rhesus negative blood type need to pay special attention to their blood reports to avoid complications during pregnancy and childbirth. Don'ts. The correct sleeping posture is extremely crucial for your body. Try to sleep on your left side as it optimizes blood circulation and the supply of oxygen and nutrients for you and your baby. It will also help your kidneys to function smoothly and reduce swelling. Quit smoking and alcohol consumption completely. Also ensure that you are not in the company of smokers, as passing smoking is harmful to you and for your baby. During the 7th month, you will not be able to bend. Try not to slouch and maintain a correct posture all the time. Number 4. Avoid lifting heavy objects. You need to delegate the responsibility of carrying heavy stuff of your family for a few months. Now we will discuss food to eat during the 7th month of pregnancy. In the 7th month of pregnancy, diet is very important and it is essential that you follow the instructions of your doctor carefully. This is the time when your baby develops his cognitive and visual functions, so it is important that you consume omega-3 fatty acids. These fatty acids will enhance the growth process in the baby. Fish, eggs, and seafoods are a few rich sources of omega-3 fatty acids. Consume fruits and veggies rich in vitamin C and iron. Iron intake is extremely important at this point in time. You can include spinach, meat, eggs, green, leafy veggie, etc. that maintain natural sources of iron. Tips for coping with the 7th month of pregnancy. Here are a few tips for coping with your last trimester. Although hormonal changes include mood swings, it is normal to be emotional and anxious at this time of your pregnancy. If you're carrying for the first time, it is definitely tougher to put your mind at ease. Just try to relax and be prepared for the surge of emotions during your last trimester. Read about childbirth and labor to understand more about what is to be happen. This will mentally prepare you for labor. Take weekend breaks. Getting away to a nearby resort with your partner will make you feel special and relieved from anxiety. Openly discuss your concerns and fears with your partner. It will lighten your stress, strengthen your bond, and also help him understand you better. Start preparing for the arrival of the baby. Start decorating the beautiful nursery you have most likely already built for the little one who is about to join your family. Look for names that are uncommon and unique. You and your partner can also visit smart parenting seminars. If you are working, this is the time for maternity leave. Take a break from office pressure and relax at home, surrounded by the love and care of your beloved family. In case you experience any of the following situation, you need to consult the doctor immediately. If you experience extreme pain or pressure on your lower back, compressions in the pelvic area, and extreme pain that also spreads to the lower back and thighs, or you feel reddish-brown colored discharge, so it will also emergency situation. Experience the onslaught of immense dry excitement and emotional pangs with your last trimester. Follow the tips mentioned above and try to relax and be happy. Positively and happiness is the key to happy parenthood. Happy parenting. If you like my video, then like it, share it, and also subscribe my channel to encourage me. Thank you.